Marilyn asks, could you explain how individual measures impact cost calculations? The colonoscopy measure, for example, is preventative. Does that change cost calculations at all?
Well, thanks, Kyle, and thanks, Marilyn. Great question. Um, every cost measure is unique, so it's the colonoscopy measure is not does not function at all like any of the others. Uh, there's a set of things that make each cost measure unique, and that's reflected in the specifications that you can find on the qpp.cms.gov website. Every cost measure is defined by a set of triggers. And a trigger is a CPT event, sometimes defined as well by a set of ICD diagnosis limitations. But when Medicare receives those, it triggers a cost measurement for the type. Then there's attribution rules. That is what clinicians can be attributed cost for these. So not everyone can be eligible for every cost measure. Then there's a list of services that are attributed to the total cost of the procedure. So additional CPT and or ICD, with or without ICD codes, that get attributed to that episode, and each of these has a time frame. That if that code shows up in a bill to Medicare within a certain time period after the trigger event, then that can be included in the cost calculation. And then there's certain things that can be excluded, again, divided by or indicated by CPT ICD codes, services that they don't care to track. And then in the specifications, there's a set of risk adjusters. That is what characteristics, again, defined by CPT and ICD codes, what change the episode cost dynamics enough that they should be included as adjusters. So all these are listed. You can find them on the qpp.cms.gov website. They're a little bit dense and difficult to understand, and you can also on that site find some overview documents that help as well. But again, just remember that every cost episode has unique specifications. None of them, although they are the same in the characteristics I just described, within those characteristics, they differ dramatically. So your colonoscopy won't be measured at all like any of the other cost episode measures.